Welcome. This program has been designed to help you care for your child and his or her feeding tube. We will cover getting started, why feeding tubes are used and the types of feeding tubes, how to care for your child's specific type of tube, management of feeding tubes, tube feeding your child, and giving medications through the feeding tube. Now let's get started with some of the basics.
There are several reasons why children need feeding tubes for nutritional support. Prematurity, problems with swallowing, or specific medical conditions such as cancer, Crohn's disease, short bowel syndrome, or cystic fibrosis, where weight maintenance and gain are important. Feeding tubes can also be used to support a child during hospitalization for an illness, trauma, or surgery. In addition, they can be utilized for children who are diagnosed with failure to thrive or developmental impairment.
There are several types of feeding tubes. Here's a brief description of each.
For children who need tube feedings for less than 4 to 6 weeks, a small tube is placed through the nose and goes down the esophagus or throat into the stomach. This is called a nasogastric or NG tube. When tube feedings are needed for more than 6 weeks, a more permanent type of tube is placed. One type is a gastrostomy or G tube. This tube is placed surgically through an opening into the stomach called a stoma. Part of the tube lies in the stomach while the rest of it extends outside the body. Another type of G-tube is called a low-profile or skin-level tube. It may also be referred to as a button. Here, the tube is placed in the stomach. However, instead of tubing on the outside of your child's stomach, there is a small plastic button or disc which lies at skin level. There are also jejunostomy or J-tubes that can be placed into the small intestine, which is below the stomach.